Professor Menon, how do you judge and assess the fact that in percentage terms of population, the number of cases in Maharashtra and Kerala, both cases and deaths, seem to be greater than UP and Bihar, although UP and Bihar have a considerably bigger population? Is this an indication of some measure of laxity, or is it the opposite? Does it suggest good detection in Kerala and Maharashtra and a more effective healthcare system? Which of the two?
So let's look at that question again and ask, what are the parameters by which you decide whether a state does well or doesn't? And one way to do that would be to compare the number of infections in the population in that state, obtained by a serological study, which really looks at the antibodies that are there that have been generated either from a vaccination or from a prior infection, and compare that to a record of an official record of how many cases the state had. And that's where the gap becomes very, very apparent. For in Kerala, in the previous wave, in the Delta wave, the factor was about 6 or 7. For UP, the factor was about 100. So for every 1 detected case, there were 100 undetected cases. In Kerala, for every 6 undetected cases, there was 1 detected case. So that suggests, so that gap is really an indicator of how well the public health system picks up new cases. That would be the real index. And the same is true for Maharashtra. So these states had low seropositivity compared to the average across the rest of India. So they were doing a better job of controlling the infection compared to the rest of India. By exactly that same analysis, other states in India were not doing as good a job. They were not picking up cases. That gap was considerably larger. And that, I think, is the real way to think about it. What exactly is the discrepancy between the official numbers and the actual numbers as inferred through some sort of measure that is objective, such as a serological study?
So in layman's language, what you're saying, and correct me if I'm wrong, Professor Menon, is that when people look at statistics broadly presented without context in a newspaper and say, oh, you got that many more cases in Kerala and Maharashtra and so much fewer in UP and Bihar, and therefore come to the conclusion that UP and Bihar are doing better, actually, they've come to the wrong conclusion. The reason why Kerala has more cases or Maharashtra does is because A, they did a very good job at protecting people and therefore the seropositivity level was low. And now they're doing an even better job at treating them when they do fall in. That's not the case in UP, where for every single detected case, 100 are missed.
So that's broadly true. When you look at numbers, you have to understand the context of those numbers and the way they present it and what they mean. So that's certainly something to worry about. Overall, now we believe that Omicron is a milder than the earlier Delta variant. That certainly seems to be true, as Professor Khan spoke about the decoupling between the cases and, for example, hospitalizations. The fact that these populations, the Kerala population and the UP population, just to take these two examples, are very different in the way they're structured in age. Kerala is one of the oldest states in the country. UP is among the youngest. All of this factors in. If you have a population that is young, will barely notice the disease when it strikes it, that certainly impacts that population differently from a population that is older on average, has many pre-existing conditions that predispose you to worse outcomes, is well connected internationally, is much more urbanized. Many of these details enter. So it's a little hard to compare different states on very simple metrics. We should be aware of all of this when we think of the numbers.
Would you agree with that basic point, Professor Khan, that without the context and the background, when you look at the bold statistics presented either on television or in newspapers, people tend to come to the wrong conclusion about Kerala and Maharashtra and believe that, in fact, it's doing a lot worse, whereas the truth is they've done probably better than most other states?
Oh, absolutely. I think the most objective data we have, the most balanced across the country, really has been the sero surveys. And those sero surveys have told us about the levels of infection in different parts of the country and have clearly demonstrated that we acquired high levels of infections in adults and children across the country. And for both children and adults, the lowest levels of seropositivity were in Kerala. And as Gautam pointed out, that is the state that is the oldest, therefore should have the highest risk factors. A lot has been made out in the media currently about the deaths in Kerala that are currently being reconciled and the high numbers that are being reported now. I would argue, as others have done, that this leads to a sort of changing of the metrics and an inability to use them appropriately when the deaths are reported long after they have occurred. It would make much more sense to revise the older figures to show the deaths when they actually happened. But even with these high numbers being reported now from Kerala, we have to look at the fact that the mortality rate is still lower than the rest of the country, which means that while we might want an improvement in healthcare systems across the country, in Kerala, they are doing a good job of keeping mortality rates low.
Let me ask you a follow-up question, Professor Kang. In July, when I interviewed you, just after the second wave had receded, you said that in terms of its testing, its strike rate, its vaccination rate, and its mortality rate, Kerala had done a superb job controlling the spread of the virus and was a role model for other states. Now, as you are in the third wave, would you have the same opinion of Kerala?
I think after the last elections, from what I've heard on the ground, Kerala let a few things slip, but by and large, Kerala should be comparing itself to other countries in the world, not necessarily to other states in India, because it has a reporting system, a healthcare infrastructure that is more like many middle-income countries rather than many of the states in the country that are like low-income countries around the world. So has Kerala done a good job? Absolutely. Has it done the best it could? I'm sure there's always room for improvement.